I'm Dr. MC Uthappa. I'm the head of interventional radiology in the Bangalore group of Manipal hospitals. We are a team of 4 consultants providing interventional radiology service. Today I'd like to talk about a recent procedure done at Manipal Hospital, Varthur Road, called prostate artery embolization. This was about a 79-year-old gentleman who had significant symptoms of urinary tract problems due to an enlarged prostate. After complete initial assessment of IPSS scoring, CT angiography and PSA levels, we counseled him for prostate artery embolization. The procedure is a day care procedure done with a tiny incision and catheter placed in the prostatic arteries under X-ray guidance. And once the blood supply to the prostate has been cut off, the prostate gland shrinks, and within weeks the patient sees a significant improvement in the urinary symptoms that they were suffering.
So we treated this patient named Prasad Rao. Prasad Rao, he is aged 70 years, he is a gentleman. Came with complaints of poor urinary stream, and he had increased frequency of urination. So even in the mornings as well as in the nights, he used to get up and pass frequent urination. And subsequently in the evaluation, he was diagnosed to have the BPH, or the benign prostatic hypertrophy of prostate gland. So the gland was approximately measuring 48 cc in volume, and his uroflowmetry was also indicative of the obstructive pattern which we see in the BPH. There are 2 options for this kind of a patient. One is the medical management and the other is the surgical management. So he was tried prior for 6 months with the medical management, but which was not helping him. In our department, we use to treat these kind of patients with a pinhole kind of a option. So this, we do the PAE, or the prostatic artery embolization, with a very small pinhole. So we gain access into the blood vessel near the groin of the patient. So that is a very 2 to 3 millimeter pinhole. Through this we gain access into the blood vessel and take angiogram of the pelvis region where the prostate gland is situated. So when we assess the blood supply of the prostate and see which all the feeding arteries going towards the prostate, we inject medicated plastic particles called the PVA particles into these vessels, which will decrease the blood supply to the prostate gland. So eventually what happens is, over a period of time, the prostate gland shrinks and the symptoms of the patient becomes better. The urinary flow becomes better and the stream becomes better, and the patient will have less and less symptoms. So this is most of the times we do under day care, and sometimes if the patient has some mild discomfort, we keep him for 1 more day. So the Prasad Rao patient, we did him the procedure on afternoon, and he was doing well, and immediately the next day in the morning we reviewed him with no fever, no pain in the leg and in the pelvis, so we discharged him. So during the discharge, we tell them to take some painkillers if at all, if it is needed. And we check on them after a week with a telephonic interview. So this is how the prostatic artery embolization is done in our setup. So we have sufficient expertise even in all the Manipal units across the Bangalore, and we have all the state-of-art cath lab equipment which is important for this procedure.
Today I am also happy to report that we have completed 25 procedures of prostate artery embolizations for these needy patients. As we have updated previously, the prostate artery embolization procedure has been a significant landmark in patients who are suffering from benign enlargement of prostate. It is also interesting to note that these patients going forward, almost up to 5 to 10 years, do not need any form of surgery secondary to the prostatic enlargement. We wish our dear patient a similar outcome going forward in the years to come. Thank you.